Hi, good evening, everyone. I'll be presenting on inflammation this evening. So we start with a definition. So inflammation is a response to cellular injury where there are vascular, cellular, and molecular events which occur in order to clear cellular debris or pathogens in order to initiate repair. It can be acute versus chronic. These are the features of acute and chronic inflammation. So acute inflammation has a fast onset, usually occurs within minutes or hours, whereas chronic inflammation occurs over days to months. The cellular infiltrates of concern in acute inflammation would be that of mainly neutrophils, and with chronic inflammation, there's that of monocytes, macrophages, and lymphocytes. The type of tissue injury with acute inflammation is usually mild and self-limiting, whereas with chronic inflammation, it's usually severe and progressive. Um, there are prominent local and systemic signs of acute inflammation, whereas with chronic, it's less prominent and might be a bit more subtle. The causes that lead to inflammation can be infective causes, so whether it's bacterial, viral, fungal, parasitic, the presence of foreign bodies, and that of immune reactions. Now, generally speaking, the sequence of inflammation would be that of recognition, recruitment, removal, regulation, and repair. And we'll go into detail with respect to each one. This is just a picture that sort of brought all of it together. Um, 1 second. So at the top, you'd see where there's the recognition of the pathogen. Oh, sorry. Then there's the recruitment of the leukocytes, the activation of the leukocytes, and then the control and termination, right, which would then lead to repair. So acute inflammation, as we said, occurs within minutes to hours. It's usually of a short duration. It's actually characterized by that of exudation of fluid and plasma proteins, and then the immigration of leukocytes. Some of the signs or the hallmarks of acute inflammation would be that of rubor, which is redness, tumor, which is swelling, calor, heat, dolor, pain, and functional laser, which is the loss of function. Now, as I had said in the definition, it consists of vascular components as well as cellular components. So the vascular components would be that of vasodilation and increased vascular permeability, whereas the cellular components include that of leukocyte recruitment, where there's margination and rolling of the leukocytes, adhesion, transmigration or diapedesis, and then phagocytosis. So we look at each one. Now, with vasodilation, initially at the point of injury or the pathogen, there's initial vasoconstriction, which usually lasts a few seconds, and then there's a resultant vasodilation, which is induced by histamine on the vascular smooth muscle. Now, the histamine is actually released by the mast cells, which are activated by the stimulus itself. And those mast cells also release leukotrienes and prostaglandins. Now, with the vasodilation, there's also increased permeability, which results in the exudation of the protein-rich fluid, which moves extravascularly, which can cause edema. It also causes the concentration of the red blood cells to increase, which would cause increased viscosity within the lumen of the blood vessel wall. And then there's slowing of the flow of the blood, which causes stasis. Now, the red blood cells tend to flow within the central axis of the blood vessel, and that pushes the leukocytes towards the periphery of the blood vessels, and that is what is called margination. This, I thought, was just a good picture to show the production of the prostaglandins and the leukotrienes and what can be used to halt the progression of inflammation. Now, with respect to vascular permeability, as we had said, the movement of the protein-rich fluid goes into the extravascular space. There's an increase in the osmotic pressure within the interstitial fluid, causing extravasation of the water from the blood into the tissues. There's also endothelial contraction, which causes these intercellular gaps, which leads to the vascular leakage. That is usually short-lived and lasts about 15 to 30 minutes. And this is just a sort of summary to explain how the exudation occurs. Now, with the cellular component, it looks at the immigration of the leukocytes. So this is actually mediated by the chemokines. So the leukocytes, as we said, would flow rapidly within the blood vessel and would be pushed to the periphery due to the stasis and the hyperviscosity within the vessel. Margination is that process where they are pushed to the periphery. Now, rolling is where the leukocytes along the periphery of the blood cell roll along the blood vessel wall, and that is mediated by the selectin family of adhesion molecules. So those would be the E-selectins, which is secreted on the endothelium, P-selectins, secreted on platelets and the endothelium as well, and then the L-selectins, which are secreted on the leukocytes. Now, the ligands for these selectins are called the sialylated oligosaccharides, which would bind to the mucin-like glycoproteins, and that is regulated by the TNF-alpha and interleukin-1. Now, while the leukocytes are on the periphery of the blood vessel wall, they become adherent to the blood vessel wall, and that is mediated by the integrins. So those integrins would allow for firm adhesion of the leukocytes. So those would be the vascular adhesion molecule 1, so VCAM1, ICAM1, which is the intercellular adhesion molecule, and VLA4, which is a beta integrin. Now, progressing from that, there's a transmigration of the leukocytes where they migrate through the endothelial wall, the endothelial gaps, via diapedesis. So the chemokines would act on the adherent leukocytes, and the cells would be stimulated to migrate through those gaps and traverse the endothelium to enter the extravascular space and migrate towards the offending agent or the pathogen. And last of the cellular component would be the chemotaxis of the leukocytes. So it's actually defined as locomotion along a chemical gradient. And that is where the leukocytes would be stimulated to move via chemoattractants. Now, within this process of chemotaxis, you usually find that the neutrophils would predominate for about 6 to 24 hours. And beyond that, the neutrophils would be replaced by monocytes, which would start to appear from 24 to 48 hours. Right? So this sort of pulls that together. Now, once the leukocytes move towards the offending agent, they would undergo activation and then phagocytosis. So within phagocytosis, the leukocytes would recognize and attach to the particle of concern. They would then engulf the particle to form a phagocytic vacuole, which would create a phagosome. And the phagosome would fuse with a lysosome, and it would form a phagolysosome, and that would undergo apoptosis. Right? So this also, again, just pulls that together. Now, the outcomes of inflammation, it would lead to resolution or regeneration and repair, or sometimes it can lead to chronic inflammation and scarring. Now, chronic inflammation, as we said earlier, is of prolonged duration. If there's continued inflammation, tissue injury, and healing by fibrosis, these things can occur simultaneously. These things can occur simultaneously. It's usually characterized by infiltration with mononuclear cells, so lymphocytes, macrophages, and plasma cells. And there's tissue destruction, which would be induced by the products of the inflammatory cell. So that would be interleukin-1 and TNF-alpha. There's also repair of that process where there's angiogenesis and the formation of fibrosis. This is just to make mention of one of the more common forms of granulomatous or chronic inflammation, so granulomatous inflammation, which is characterized by aggregates of activated macrophages with scattered lymphocytes. Now, these are some of the diseases that are examples of granulomatous inflammation. So one of the more common ones would be TB, where there's caseated granulomas, leprosy, syphilis, cat scratch disease, sarcoidosis, and Crohn's disease or inflammatory bowel disease. Right, so just in summary, Generally speaking, with acute inflammation, there is recognition, recruitment, removal, regulation, and repair. And it is composed of vascular and cellular components to help initiate repair and healing. So my reference is, well, essentially the Robbins.